do you feel that personal responsibility and health factor into that political arena? For example, what do you think about sin tax on fast food, soda, tobacco, things of that nature?
Well, there are many ways in which personal responsibility impacts this. I mean, one of the things that happens when you leave everything to government, when you say, okay, they're going to take care of me. Don't worry, be happy. There's a food pyramid. They're going to tell you what drugs you can take and you can't take. They're going to tell you whether smoking is good for you or not. Basically, don't think, be happy, and just follow the guidelines. That is an incredibly destructive mentality, and people are taught not to be self-responsible, not to question, and as a consequence, they do horrific damage to themselves, but they're just automatons following the directives from Washington. And this is outside, not just in medicine, this is across the board. We don't have to think about education. We just send our kids to public education, public school that's close by, and the bureaucrats are watching over them. Don't worry, be happy. We don't have to think about safety of our automobile. The government's taking care of that, so we're not going to evaluate which car is safer than the other because there's some standard. It just dumbs us all down, and it takes away the demand and the respect, the sense of personal responsibility. So the politics have a lot to do with the fact that Americans, generally people, don't take personal responsibility because they're being dumbed down. They're being told, don't worry. They're being told, we'll take care of you. And we're developing a mentality that is ripe for authoritarianism, where people will tell us everything about what we should and shouldn't do in life, what we should and shouldn't think. I believe that the government shouldn't be involved in any of this. That is, we should be completely responsible for our own self. So whether we smoke or not, whether we drink or not, whether we take this drug or that drug, or whether we exercise or not, all these things should be left to us, and we should suffer the consequences when we do bad things. So we need to go back to an era of real personal responsibility. That means the idea that people own their own lives, that people are sovereign over their own lives, and nobody else has a right to tell me what I can and cannot do. And if I want to commit suicide, that's my problem. I die, as long as I don't take you with me. And if I want to smoke, then I get lung cancer, I pay the cost of that. If I want to drink, as long as I'm not risking somebody else's life by driving while I'm drunk, if I just want to drink and destroy my kidney and destroy my life more broadly by getting drunk on a regular basis, my problem, let me rot. So I think society has collectivized these risks, has taken these risks and made them political when they're not. They should be brought back to the individual, and government and our neighbors need to get out of our lives.
So a big topic for discussion on ToFIndHealth.com has been the regulation of the supplement industry. For example, ephedra-based products have been banned or are highly limited. I guess some might say that the consumer needs protection, but what are you saying then?
I'm saying the consumer shouldn't have protection, that he is his own protection. And consumers in a rational, free society don't have to just rely on themselves. There are experts out there. So, for example, I don't believe there should be an FDA. Not only do I don't believe that supplements should be regulated, I don't believe any drug should be regulated. So what do we do? Because we're pretty ignorant as consumers. Well, that's why we have doctors. What do we have doctors for? And it's important that we choose the right doctor, one we feel comfortable with and has the right diplomas and is qualified. And they should be advising us in terms of what drugs we should and shouldn't take. And if we don't trust them, get a second opinion or a third opinion. There would be, like today, there's Consumer Reports, and I can go in and I can find out what the most trustworthy television is. It's not a government program, but you would have the equivalent of Consumer Report for drugs, and you would have many companies competing to provide us with information. Well, drugs are so important. They're so important to longevity and to a successful life when you get sick, or maybe even to allowing us to live to be 200. Who knows what's coming down the pipeline? But the only way we're going to get these wonderful drugs is we leave the pharmaceutical companies free, and we allow us to make those choices about how much risk we're willing to take, what kind of drugs we're willing to take. One of the greatest tragedies that exist in the United States today is the fact that people die of diseases where there are experimental drugs that might cure them, and the FDA decides that even though you're dying, you can't try this drug. I mean, the logic of that is inconceivable. Or take the example of Vioxx, right? Vioxx was a drug that treated pain. And it turned out that in some people, it caused heart disease and increased the risk of a heart attack. In some people, right? So those people who weren't at risk of a heart attack had to give up Vioxx. It was withdrawn from the market because other people might get heart disease. And you could probably devise a test to figure out who wouldn't get it, and then gift it to some and don't give it to others. No, that's not acceptable. If it causes heart disease, heart problems to some people, take it away from everybody. And so this whole issue is, let's bring back that decision making to the patient, to the doctor, to the consumer. The marketplace will create lots of mechanisms to provide us with information. Yes, we'll make mistakes. Yes, there are risks involved, but that's life. The only time you don't have risks in life is when you're dead. Life involves taking risks, and these are risks worth taking because they involve our survival, and they involve curing disease, and they involve reducing pain, and they involve quality of our life.
So do you think then the private sector can provide these products and services safely without any government oversight?
I think more safely. I think what happens with government oversight is they create this standard, this minimal standard, and if you're a drug company, you can pass the FDA test, and you don't care anymore. But imagine if there were no FDA tests, and they had to kill all the time because they could get sued, or the drug people would stop using the drug, and they'd lose a huge amount of money. They'd have to worry about safety constantly. They couldn't say, well, the FDA said it was okay, so we don't have any liability. That wouldn't be a defense, which I think is a legitimate defense today. But it wouldn't be a defense in a truly free market. And not only that, there'd be a huge monetary incentive for people to go out there and create their own FDA, right? To create a private FDA test. Now, for every 1,000 compounds they try, I think 5 get to the point of testing in the FDA. And of those 5, 1 makes it to market. And then some of those get withdrawn. So it's 1/10 of 1% of all the compounds they start with, and it costs over $1 billion to make a drug. So first, that means that they only do drugs that have mass appeal. They're all going to try to create Viagra, right? Because everybody wants Viagra. It sells huge quantities. But if there's a small cancer, let's say pancreatic cancer, I can't remember what the numbers of people affected by, tens of thousands maybe. But you die, right? There's no cure. You die within 3 months. Bam. But what's the incentive to develop it? You'd think that huge. The FDA won't allow it because it might hurt them. As they're dying, they might lose their eyesight. Well, they don't care. They just want to not to. It's so absurd. It's hard to imagine. But it creates perverse incentive for the drug companies, perverse incentive for drug doctors. We destroy these marketplaces. What we need is freedom. Freedom works. It's always worked throughout human history. And the more we try to limit freedom, the more distortions and perversions we get in the marketplace. And it hurts doctors, patients, drug companies, everybody. I think the science is such that we have the perspective of living to be over 100 years old as pretty standard stuff. And I think that won't happen because of the FDA and government policy that restricts real innovation.
You are proposing what many consider to be a radical point of view, which is that healthcare is not a right. Can you explain how and why you hold this position?
Well, to me, it's just bizarre that this would be considered a radical position. This is the position of the Founding Fathers. This would be a position of almost all Americans until just a few decades ago. The idea that healthcare could be a right means that food is a right, and clothing is a right, and housing is a right. Well, I guess that's why we had Freddie and Fannie, so maybe it is. But, that anything that we need is a right, that I need just creates a right. But that's not what rights mean. That's not what rights mean by the people who invented the concept of rights. Rights mean freedom. Rights mean that leaving us alone. That the political system is out of our life. That's what it means. It's a right to action, a right to do stuff. A right cannot be a right to something that you produce, because that makes you my slave. It makes you my servant. We need to take care of ourselves. We need to pursue the values that make our life better. And then nobody else is responsible to providing those rights. We have to do it. The Founding Fathers said we had a right to life, liberty, and the pursuit of happiness. That doesn't mean we have a right for other people to give us life. It means that the government needs to stay away as we go out there and search what really gives meaning and fulfillment to our life. That's what it meant by pursuit of happiness. We need to go out there and pursue happiness, and the government needs to butt out, and other people need to butt out. That is, nobody has the right to force me to do something I don't want to do. Founding fathers of this country and John Locke, who invented, came up with the concept of rights, are rolling in their graves.
Well, we're actually going to be moving on to something a bit lighter now. This is considered to be our ToFIndHealth series.